Hello and welcome to the Bee Formless Flow Driven CEO podcast. Today, or this, I won't say this morning actually. Today, I have on the show Somer Baburek. Welcome to the show, Summer.
Thank you. Thank you for having me.
Yeah, so Summer's based in Texas. It's Thursday after, I'll say it's Thursday evening, heading into the evening, early evening, I should say. Thursday and Friday morning here with me. Summer, I'm so excited to talk to you because what you're doing is quite incredible. And 6 years young in February 2026 coming up. But you're the
Mhm.
co-founder and CEO of Hera Biotech right behind us. And by the way, I love the color purple. So great to see your name in purple. Got a bit of matchy-matchy going
Thank you.
on here. Which
Yeah.
is a women's health company, which is a precision diagnostic company, I should say, novel, non-surgical diagnostic, and you have products that specialize in endometriosis and cervical cancer, something that so many women, face and endure,
Yeah.
and you just see so much of it. And you'll have the stats around how many women, experience this. It's astounding and quite incredible and yeah, just what they have to go through. So I love that you're in this space and you're on the mission to transform the reproductive healthcare. You've raised millions in venture funding and built Hera as a science-driven yet deeply personal endeavor. Your journey reflects the courage of trusting your intuition, or I'll get to that, the answer to my question when booking in on the pod, staying true to purpose and leading through conviction. You're also a mum. Did you say you've got two or three kids?
Yep.
Three?
I have three. Yeah. Three
How,
girls.
oh, three girls. Great. They're going to be like stepping into
Yeah.
Hera down the track. How old are the girls?
I've got 12, 10, and 2.
Yeah, right. Wow. Good. That'll keep you on your toes as well. So what a
Definitely.
power woman, co-founder
Uh,
and a mom and everything else going on. Tell us how you come to found Hera Biotech, this deeply personal
yeah.
endeavor of yours. Tell us a bit about it.
Yeah. So prior to founding Hera, I was working in venture capital, and I was working in two of our fund companies that were in the drug development space. And we exited those companies, and I really wanted to get back into women's health. I fell in love with women's health in my undergrad. I invented a medical device around the labor and delivery with my first daughter. And so it felt like the right time. And if I'm being completely honest, I looked for other jobs first, and most of the jobs I could get would be on the coasts in the US, and I live in the central US. And the cost of living is very, very different. And I just didn't feel like I could move my little family and dogs to a tiny little apartment somewhere. And so my husband came out one night and he said, well, gosh, if only you knew how to like write business plans and, raise venture funds and look at technologies. And I thought, oh, right. I do know how to do that, don't I? So he's probably regretting that comment now. But that was really the encouragement that I needed to kind of jump off and say, all right, I can do this. I can get back into women's health and I can do it. So that's when Hera was formed. I formed the company in February of 2020. So I always tell people like hold your applause for my perfect timing because March COVID hit and then
Yeah,
the
it's
world ended.
crazy. Like, did you like
Yeah.
to think that you started in February and then the next thing we're getting like these little, the global announcements around, oh yeah, like things are happening overseas. Well, we were getting it, and the next thing it's like, holy, this is getting wild.
Yep. Yeah, and I'm fairly confident that my husband was like patient zero in Texas, in San Antonio, where we live. And we were sitting there on the couch, and it was like, oh, we've detected, COVID. Patients were in the, Denver airport, and my husband had just flown back from and came through Denver, and I was just like, oh,
Did he get it?
he did, and we had to like report to the CDC like how he was doing. I was like, am I gonna have to like report that my husband is dead? Like, I mean, how is this gonna work? Like, I kept him locked in our bedroom, like like he was quarantined in there, and I would bring him like food and put it on a table and then push it through the door and make him eat.
Oh my
We had
gosh.
things called COVID dates. So I would sit on the floor and we would watch a movie and he was like in the bed. We were way apart from each other. It was so crazy. But yes, that's when I founded Hera.
Oh my gosh. And how did what quickly the Hera, the name, how did you like, because I love the name. How did you come up with the name?
Yeah, so Hera is the Greek goddess of family and fertility. She is a fierce protector of mothers and women, and her rage is legendary.
I love it.
Um, yes, and so I thought we needed some of that energy if we were going to try to tackle some things in women's health.
That's
So
so
that was where the
cool.
name came from.
I love a bit of Greek
Yeah, and
mythology. It's amazing.
well, and you'll notice our logo is a peacock feather, and Hera is fabled to have created the peacock. Zeus killed her protector, which was a thousand-eyed giant named Argus, and so Hera is fabled to have created the peacock, and she put the eyes of Argus on its feather so that she would always feel watched and protected. So that's why we
Oh
chose
my
the
gosh,
as our
I
logo.
never knew that. I've been to the Acropolis and done all, I love Greek mythology. I've been to Greece, but I did not know that. Wow. Did you know all of
Yeah,
this before getting like, oh, had you always been?
I I may or may not be like a complete mythology like nerd, and I love it
Okay,
all.
cool.
And I think it's all super interesting. Greek is my favorite mythology, but I think Roman mythology is super, super interesting. And Indian mythology is super interesting to me. But it's funny because then, the Percy and the Lightning Thief came to Disney. And my kids watched it. We watched it as a family. And at one point, there's a scene where there's this throne, and they're like, "What is this throne? It's made of gold. It's so beautiful." And the one girl's like, "I know what that is. That's Hera's throne." And my girls were like, "Hera's throne?" I'm like, "That's right. Mom's cool now because Disney covered Hera."
I love it. Okay, so take us
Yeah.
keep going. I'm loving this story. I'm loving the whole the
Ah,
your husband's got like he's almost like passive aggressively said to you, if only you
yeah.
know, like if
Yeah.
only like yeah, calm down. And then
Yeah.
started in
Yeah.
COVID, Hera, yeah, like endometriosis,
Yeah.
cancer, like where was is there
Yeah. So I started looking at the landscape. I was looking at drug development because that's where I had been working in a couple of our fund companies. And what I saw was that outside of oncology, we really weren't doing much around treating the disease. We were really seemed to be focused on getting symptoms under control, which is noble for sure. But if we're not fixing the underlying condition, there's a problem. And so that led me down the rabbit hole. My master's is in data analytics. So I just started just digging in. And I realized, oh, well, we don't track progression of these diseases very well. And we don't diagnose many of them very robustly. So, how would pharma do what it does best and develop drugs if we can't give it the information it needs to do it? So I felt really like what women's health needed was a robust diagnostics company that was focused on going after the root cause of these diseases, understanding them mechanistically, and empowering actual change in the way that patients are cared for, and giving pharma the insights that it needs in order to develop meaningful interventions for these indications. So we started with endometriosis. That's arguably one of the largest unmet needs in women's health.
yeah, it's
A
very
lot of people don't know what endometriosis is, so I always like to talk about what it is. So it's quite literally when tissue that very much is like the lining of your uterus. So it's believed that the genesis of this disease is from the lining of your uterus, grows outside of the uterus. So it's very easy to think of it like a cancer. It's tissue growing where it doesn't
yeah.
belong. And it behaves exactly the same as it would in the uterus. So every month it swells, it bleeds, it breaks down, and it sends the body's immune system into a complete and total meltdown because there's all this tissue where it doesn't belong. And it has a number of non-specific symptoms. So heavy menstrual cycles, pain with intercourse. It's the number one cause of female infertility. And the stat that people really freak out about, there's two. One is it is more prevalent or as prevalent as diabetes.
Wow, I
So
didn't know that.
200 million women worldwide are affected by
Gosh,
endometriosis.
that's huge.
We don't have a diagnostic and we don't have a treatment. So just imagine if we couldn't diagnose or treat diabetes, like what that would be like for people. Um, and the other stat is
So hang
on
on,
average,
right now we do not have a diagnosis or a specific treatment. So
the
that's what
only
it says
diagnosis
constant
for,
explore. Yeah, sorry, you go.
yeah, the only diagnostic available for endometriosis is the surgery. So the surgeon goes in and looks for the result of the disease growing anywhere from the base of your lungs or the diaphragm all the way down into the lining of the bowel. It can be anywhere and it can occur in about 7 different colors. And lesions can be super, super small, like the tip of your pinky finger.
Cause
And
habit.
just, yeah, and it causes havoc. And the other thing is, just your severity of your symptoms doesn't correspond with the disease state. So you can have somebody who's in this intense pain, but they have very early stage disease, which means they don't have a ton of lesions. The lesions they have are very small. It's like an impossible task to give a surgeon to go find something.
Wow.
So yeah. And then on average, it takes 8 years to get diagnosed.
Wow.
Yeah,
Wow.
it's not great. It's
No,
not great. So it's a huge disruptor of people's lives. And you hear a lot like, oh, well, it doesn't kill you. Well, doesn't it?
it kind
I
it
mean,
really does. So does like it really does. Like in terms of it's enough getting you having your menstrual cycle each month as a woman, and especially as you're getting older as well. Like it's just like everything's it's like constant, right? You've got the
right.
ebbs and flows, but then to have that on top of and just
Yeah.
no cure,
And
no
when I say
solution.
pain, everyone thinks like, oh, periods. Well, periods are painful. Well, no, they're not actually. They're not supposed to be. And when I'm talking about pain, I'm talking about women black out. They pass out, they're driving a car, they pass out in the bathtub, they pass out at work. And I'm talking, when I say heavy period, I mean women are almost bleeding out. They're going anemic every single month. And so it's not normal and it's not okay. And it's not something that we should minimize or trivialize by saying it doesn't kill you. It's associated with over 60 comorbidities.
Well,
So it statistically significantly increases your risk of getting things like ovarian cancer, endometrial cancer, breast cancer, cervical cancer, osteoporosis. So a whole host of things. And I'm not even going into all the mental health concerns. I mean, so it is a big problem.
mm,
So that was where we started. And then as we developed our product in that space, and we took a look at the broader space, we realized, okay, we're talking about patients who have endometriosis. They could also have and are likely to have any of these other 60 conditions. And those are things we don't diagnose either. So what if we took the expertise that we have in building machine learning algorithms to be deployed to go analyze these things and looked at other indications as well? And so that was when we came to cervical cancer, and we actually acquired that technology from another company, but it uses machine learning algorithms, and it's a device. So I know any woman here has had a pap smear and no one likes them. So our device doesn't take a physical sample. We use electrical and optical spectroscopy. So we just have to touch the cervix. Each touch is about a second to 2 seconds. It takes 90 seconds to do the exam. And
that like
we
a
read the
cervical
entire.
screening? Is that the cervical screening one?
Mhm.
Like versus yeah, because
Yep.
like oh yeah, yeah, yeah,
Yeah.
yeah,
So yeah, it's super simple and it's an immediate result.
yeah.
So you know immediately whether or not you've got lesions we need to be concerned about, and we can move you straight to treatment.
Wow. So you're almost
Yeah.
you're finding solutions for at least yeah, being able to diagnose to then be able to work out what the treatment plan is
Yeah.
versus going around and around in circles, wondering if, as a woman you're going crazy because everything's wrong with you, but you just can't seem to get an answer.
Yeah.
It's quite
Yeah. It's
incredible.
uh it's exhilarating. It's really exhilarating because I think about like every exam you've ever had, right? Especially when we talk about cervical cancer. And I think like, how would that may have been different? I mean, I don't know about anybody else, but like anytime I have a pap, it's bleeding, it's cramping, it's this, it's that. And it's like, why does it have to be that way? It
Yeah.
shouldn't.
Yeah, it's
Why? Oh, because
cringe. It's like you just
yeah. And
people avoid it. People avoid it. Like I mean, as soon as that cervical screening test came in, I was like, this is so much like, different. Like, yeah. But it's still,
yeah.
yeah.
So the one you're familiar with is a competitor of ours, but we're better.
Yeah. No, I'm sure yours is better.
Yeah.
I'd love to be able to give it a whirl. I'm here in Australia. I'm like, send it over here. I'll
Yeah.
let my gyno know that I've met you and there's a different product. But, just, I can only imagine yours is better. Like, it's just,
Yeah,
but yeah, I guess the point is, though, it's like we shouldn't have to, as women,
exactly.
stuck in the 19 whatevers, and instead we're in this modern world.
Yeah.
AI's here, there's all this really cool stuff going on, and you're like the frontier trying
I'm
to,
trying to be.
yeah, trying
Yeah.
to eradicate some of these fundamental mental issues that have been around. Like
Yeah.
you see the suffering from women with endometriosis, and I've got friends and family, and you're just like, oh my gosh, like there's got to be a solve for this. Like,
Yeah.
it, you know.
Yeah. It's got to get better. And it has to be something that's actually scientifically based. I think the other thing that we see a lot in women's health right now is um, people trying to go to the last chapter when we haven't even written the introduction. We know so little about so many diseases. And then people are like, "Oh, we can develop an algorithm and we'll find markers in your urine." And it's like, based on what? Like,
What do you
based on what rationale? Like, you don't even know how this disease starts, and you think we're going to diagnose it in the way that she breathes. Like, what are you talking about? It's just, and I understand the excitement and the enthusiasm about leveraging some of these quantitative tools, like you're talking about with AI and machine learning, and they do make your work so much easier, but it doesn't mean that you can just jump to the end of the book and just make an assumption.
No.
That's a fishing expedition. And correlation is not causation. So, I get a little concerned about people utilizing these tools, and essentially what they've done is created an algorithm that is based on a very small or biased data set, and they've overfit it. And so it's not going to be clinically useful, and it's going to cause a lot of issues if it gets out into the wild and people start using it on a diverse population. And so you have to be very thoughtful about how you deploy and develop these tools as well.
Yeah, so that probably takes me to my question because when you booked the card, I asked what's one unique insight or lived experience when it comes to life leadership or business, and you said the importance of going with your gut, knowing why
Yeah.
you're doing what you're doing, the way you're doing it, and sticking to it. I'd love you to answer
Yes.
that because everything you've just been talking about is, there is this tendency to go, oh, AI can solve this and that. At the end of the day,
Yep.
data requires a human, like you're saying, I think, like the human
Yeah.
component. And by the sounds of things,
Yep.
gut intuition plays a huge role in that to be able to then solve what the actual real
Hmm.
answer is to the problem. Tell us, yeah.
Yes. So when I first started building, and we focused specifically on tissue and looking at the endometrial tissue as a means of diagnosing, we got a lot of pushback. And it's like, oh, well, other people are trying to do this in the blood, and people would much rather take a blood test than have an endometrial biopsy. And oh, well, why can't you just ship a kit to their house and collect their menstrual effluent and do it that way? Like, people are doing that. I'm like, well, they're not doing it. They're telling you they can do it, but they have no basis for why they're doing what they're doing. And remember, our goal was always to change the entire care path for a patient. You have to have actionable insights. You have to have databases that can be utilized to expedite and make drug development more efficiently. Because what good is it to tell her that she's got it if you're not doing anything else? Like, it's helpful that she knows that she has a disease if you can do that definitively. We don't do definitive diagnostics through the blood. I mean, but that's fine. But to say, oh, you're at an elevated risk of developing endometriosis, best of luck. Like, what? That's terrible. But we heard that a lot. And so, we had to stick to our guns and say, no, it's important that we understand the tissue. It's important that we understand the mechanism. It's important that we collect it and understand the science behind it. And now we're starting to see the tide turn where we are seeing pharma companies come to the table and be like, we've been trying to develop drugs in this space, and we're not going to be able to do it without data. And it's like,
Yeah.
oh, well, if only a company
Yeah.
had built their whole company around making sure you had what you need based on what we're doing.
Yeah.
And so that's been rewarding. But It took 5 years. I mean, I only just recently started hearing this. And so I think a lot of people, and I had a lot of nights where it was like, well, screw it. Should we just tell them we're going to do an app and have people answer questions and we'll tell them whether or not they've got endometriosis? I mean, we can make this as completely non-invasive as you want. We can make it super easy. She blinked twice, so she probably has endo. I mean, and I just thought, no, that's not the right thing to do. My gut just said it's just not going to work. It doesn't make sense. And eventually this is going to
It'll
be
work.
revealed.
Yeah. It's
Yeah.
almost like you've been
And
on
now I'm
this,
starting to see it.
yeah, you've been on like this solution finding that, like it's kind of that's the problem, right? We so often go problem quick to jump to the solution, but it never is the solution. And perhaps that's maybe why we're here today in the world with regards to like things like endometriosis, cancers, why we don't have a cure still. Like you think about that disease, it's been around forever in a day, and yet we still can't seem to find actually, well, is there, how do we cure this horrific disease, right? And then what you're
Yeah.
doing is you're going to the data, you're looking at it and you're finding ways. And then it's almost like the farmers of the world and everyone else. It's like you're building this ecosystem, if you like, but it starts with you guys. It starts with where you're at, and then you build out. And it's almost like the plan for the female or the woman, I should say, it comes out of that way versus just
Right.
standing out all the way over here going, there's the answer, but you haven't done any
Right.
work of where it actually, how are you pinpointing it?
Yeah, that's exactly right. And I mean, we've come so far in cancer. Like cervical cancer is one of the most curable cancers ever.
Yeah.
Like no one should die of cervical cancer
Yeah.
ever. And the trick is diagnosing it early. Well, then let's do that, right? Accurately and robustly for all people, not just people who have very sophisticated lab equipment and cold chain logistics and plenty of doctors everywhere, right? And so that was the genesis of that. And, we think about it in like, when people will say, oh, well, all people who have endometriosis are just chronic pain patients. They're just pelvic pain patients. So you just need to treat them like you would somebody who has pelvic pain. And I'm like, all right, well, then everybody who has cancer gets chemo. Same kind of chemo. Everybody gets it. Same kind, no radiation, no supplementals. Just give them the chemo, the one chemo drug. No, that doesn't make any sense, does it? Right. So we can't just take an entire category of patients and treat them all like one
You're
big
a weapon,
universal
Summer.
blob.
You're an absolute weapon. I would not want to mess with you in a boardroom or with like, raising capital, etc. Because I could just, you just would be like, no, which is,
Yeah.
is is completely. I love it because even that analogy you've just used then is
Yeah.
true, right? It's like no, it's not a one solution fits all. It doesn't work that way. So it's like, how do you
Right.
bespoke it? Let's pivot because I do want to get to this women leadership and this like
Yeah.
need to have the courage, but you've certainly got the empathy, right? And but
Yeah.
you've got this, but you're this woman that's on the mission, it's trusting your intuition as it's all of that. Do you come up against a lot of, I guess, people? I shouldn't say men, but do you come up against a lot of men that kind of almost, sometimes, oh, it could be women as well that almost like try and derail what you're doing, like in terms of because you sound like you're a real frontier, like you're reshaping,
Yeah.
how to find solutions, etc. in biotech. Yeah.
Yeah. I think if I'm being honest, the women can probably be the worst offenders.
Yeah.
Um, there's almost this like, I don't, it's not a mindset I understand. It's just a mindset I've come to recognize of like, it was so hard for me to get to wherever I am at this moment. And so I'm doing you a favor by being this hard on you. Um, because then you'll at least be ready, right? And it's like, okay. Um, also, the dinosaurs didn't know they were dinosaurs. So there's that. But I think the key for me, and I have to actively work on it, especially because I was raised in the South. Like you're supposed to be a good girl. You're not supposed to make people upset. You're supposed, all the things.
Yeah.
Um, and so I have to actively practice and think about reframing how I view being upfront, being direct. And I think the best way I have heard it phrased in a long time is I'm not being mean. I'm just not actively making you comfortable.
Oh, I like that because I'm getting a bit sick of saying clear as kind. And I'm like, it's there's
Yeah.
got to be another way. So you said it not actively making you feel comfortable.
Right. I'm not being mean. I'm not being rude. I'm just not actively making you comfortable. And that's okay because that's not my job. I have three people that rely on me for that, and you're not one of them. So that's okay. And my COO, who's a brilliant PhD scientist, I get so much inspiration from her. She loves to talk about how she practices radical candor, right?
Oh,
Like,
yes. Yeah.
I'm radically candor. I practice radical candor, and I'm like, some days I'm like, man, I've just got to channel my inner Chinzia on this issue. But I think it's important because I do believe women don't have a skill set gap. We have a mindset gap. Very few of us ask for promotions. Very few of us ask for raises, right? Or we don't negotiate hard for those things because we view it as a certain level of like difficult or being difficult, right? And so I think that if you're someone like me who recognizes that it's an issue or a struggle that you can have, actively practicing and thinking about reshaping the way that you view direct communication and um, maybe even I would say like not it's not aggressive communication, but advocating for what you're talking about passionately and not viewing it as being difficult or obnoxious or,
And you're
rude
not coming
is
across that way. You're
important.
just coming across very passionate, but very clear and very,
Yeah.
like I'm on this mission, you know,
Right. This
please,
is where we're going. This is
this is
what we're
where we're
doing.
going.
Because
Yeah.
if you get wobbly on it, then it leaves room for people to say, oh, I can shove her off this way, or I can, I have questions about whether she really believes what she's saying. So you've got to be
Have you ever had
confident in
moments? Have
her.
you ever had moments in the business where you're just like, is this going to work? And then yeah, like what,
Oh, yeah.
yeah, all the like,
Maybe
yeah.
like once a day. Are we gonna make it? I don't know. No, I have had times. I remember one instance specifically, a female investor with two other female investors on a call said that her only question for me was how I could assure her I wasn't going to be some Elizabeth Holmes situation. Hmm. And the other two women didn't say anything. And the thing I was most disappointed about is that I tried to answer her question and
Yeah.
it didn't deserve me answering it. It didn't deserve me answering it, and she didn't deserve to ask it. Um, so,
Wild.
there are moments like that where you just get, kind of
Wow.
gut punched and you're like,
What was that?
holy crap, do I just need to rethink everything? Because if that's the response, what am I even doing?
Yeah.
Um, but you have to move forward. We always I say this a lot, and I think the team thinks it's funny, but I mean it. Like, we're couture, we're not for everyone, and that's okay. Like, we're not something you can just buy anywhere. Like, we are an opportunity, we are rare, and we are tackling big important problems, and if it was easy they'd be fixed and we wouldn't be here.
Yeah. Yeah. Yeah, you're on the
Yeah.
you're not going down the beaten you're not going down the beaten path, you're going down the unbeaten path, like, and that's the only that and
Yes.
that's the trailblazing, right? And so tell me,
Yeah.
in terms of being CEO, like you're obviously a mum CEO,
Hmm.
how do you juggle it all? How do you like are you like you seem like you're the sort of person what you see is what you get. And I
Yeah.
get the sense you're summer CEO, but you're summer mum, and there's no real like you're authentically who you
Yeah.
are. I can't imagine you're putting on a
Yeah.
mask to be the CEO and then you go home and going, oh, little one, like, do you know what I mean? Like,
Yeah, no, no, I'm not. It's actually not that different being a mom and being a CEO. Um, because you're managing a lot of different emotions from different people, priorities. and it's no different than being at home. I have three different people with three different priorities and, mindsets and emotional
You got
scales that we have
four.
to
You've
deal
got your
with.
husband as well. You've got four.
Him too. Him too. And then I've got four dogs. One just walked in here. And so, got to manage them too. So it's really not that different in terms of the EQ that it takes. And so I think the biggest difference is in how I have to think about things that are different, right? So it's just a little bit, managing different types of problems. But it's very, very similar. And I try to keep myself very authentic. I think the only time I ever feel like I have to put on a mask, it's like when I do like public presentations. And that's just like a self-preservation thing. Like I can't just stand up here and talk about, being a mom. I have 10 minutes to deliver this very succinct message. And so it's, whoop, and I got to get this done. I got to get this out. And then I can come off the stage and be me again.
Yeah, I love it. I love it. And then how do you like look at how do you actively recover? Like it sounds like you've got a lot going on. How do you ensure you keep yourself, your cup full? Like what do you do?
I love to cook. So I cook dinner every night, and I feel like that keeps me really, really grounded. And of course, I do it in the most like CEO way possible. Like I have a monthly dinner menu, so everybody knows what we're having. It streamlines getting groceries and all that. But I do cook dinner every night. I think that keeps me grounded. I like to garden. It's
Uh-huh.
something that I like to do.
Same.
And so I do garden. And then I exercise. So I like to go on runs. I also lift weights, but when I go on runs, I can usually take one of my dogs with me, and that's really rejuvenating.
Amazing, amazing. Yeah, it's so important, isn't it? Like to ensure that you get those micro breaks, those timeouts for you. You know, I always find when you're whether it's I'm not a cook, but whether it's gardening or cooking, gardening grounding you, cooking, creative juices flowing, and
Yeah.
then obviously that the exercise. It's also when you get those fresh perspectives and you quite often
Mhm.
find answers you've been looking for that just
Yes.
like almost it's like coming back to that intuition, right? The ability to be able to be
Mhm.
present because you need to have the presence to then be able to tap into the inner wisdom that we've got. And I think that's so
Exactly.
important. Like, do you also, well, I guess last question, do you also how do you encourage intuition within the business and within the team? Like it's not something that
Yeah.
you teach, you know what I mean? But like,
Yeah, but I think that when you empower people to ask themselves how they're feeling about
yeah,
something, that's when you see them start to practice and flex that muscle and exercise that muscle. And so I often, I'm a big believer in the people closest to the problem are usually the best suited to solve it.
yeah,
So if I've got somebody from our engineering team that brings me a problem, I'm like, well, what do you think the right thing to do is? If you had it your way and could do anything, what would you do? Oh, well, I wouldn't worry about that. I worry about this. Whoa, why? And you
yeah.
can see them start to be like, oh, well, because, and they
Yeah,
get
it gets
excited
them
about it.
going. Yeah, it gets them going. And what's next for Hera Biotech? Like, what's next for you guys? Or you don't want to, like, yeah, what's the big next?
Yeah. So we're raising around now, and it's all about getting our products out. We start shipping our cervical cancer product in Latin America this month.
Amazing.
Um, yeah, and then once we get this round closed, we're about 6 months from launching our endometriosis product in the US. So product launches are next for us. We're
Oh,
very, very excited.
that's so exciting. Yeah, we'll have to get it. You'll
Yeah,
have to get it here in Australia, and I can be going to, like, just helping you promote it to whoever I know. You know what I mean? Like, no, I'm joking. Yeah, but
absolutely.
yeah, but no, it's sounds incredible. Last question. What would
Yeah.
be one piece of advice you would give a woman who was just at their wits' end with with their endometriosis, for example, and just not knowing where to
Mm,
go, what to do? What would be one
yeah.
piece of advice you would give them?
I would say to find a doctor that's listening to you and thinking about the disease as a whole and not just trying to slap birth control at you. Um, and I would tell her, use your intuition with that because you'll know if that doctor's actually listening to you or not, and advocate for yourself. Say, I think these symptoms that I'm having are consistent with what I hear endometriosis patients say. And I'd really like to understand if that's what's bothering me and giving me all this trouble. So don't always just go with the first answer that somebody gives you. Find somebody that you think is actually engaged and listening to you, and then advocate for yourself.
Amazing. Summer, it's been such a joy talking to you. I'll let you get to your
Thank
evening.
you.
Where do we find more about you? How do we find out more about Hera Biotech?
Yeah, you can go to our website, herabiotech.com. We're on LinkedIn. Hera's on all the social medias. I don't do social media, but I'm on LinkedIn, and it's you can find me, and I'm always happy to connect. Or you can just email us. It's contact@herabiotech.com.
Amazing. I love it. You're such a powerhouse. I wish you the utmost success. I see lots of massive accolades and achievements for
Thank
you
you.
and your team. So thank you so much for your time.
Thank you.
No, it was a real joy. Talk soon. Thank you.